Okay, this is the CSE 2020 Matrix Review. There is a much longer version. If anyone would like that, simply shoot me an email that goes over to all the exact details of the different simulation breakdowns. What I'm going to concentrate on today is the actual simulation breakdown. And the simulation breakdown, by that, what I mean is what are the case subjects? What are the simulation subjects? What diseases and diagnostic prognoses are we going over? Now, and I'm going to compare in each of these, I'm going to compare 2015 to 2020. So in 2015, we've all gotten used to the fact that there were 2 conservative management and 2 critical care COPDs for a total of 4. Now, COPD is getting bigger in 2020. There's at least 5, possibly 6, and I'll go over what that means in just a second. 2 patients are going to require intubation and mechanical ventilation, certainly. 2 patients are going to require non-invasive management. 1 is going to be a total outpatient, like a clinic type patient, not even in a hospital setting. And then the 6th is what we call the wild card. There's a whole section of chronic airway disease, and in that section includes these COPDs, but it also includes a 6th possible emphysema or chronic bronchitis, and the other possible that could be is bronchiectasis or asthma. So we're talking a minimum of 5, maximum of 6 COPD. So it's vital that students really understand COPD. Now, trauma used to be huge, and it used to be something students did really well at, but trauma is all the way down to 1. They went from 3 to 1 trauma simulation. Cardiovascular has also gone down. There used to be 3 adult cardiovascular scenarios. Now there are only 2. One is some sort of heart failure, certainly, and the other could be a mixed bag, MI, arrhythmia, pulmonary hypertension, infarct, or PE. Neurological or neuromuscular is also down. It used to be 2 sims, now it's only 1. Pediatric is about the same. I like to say it's slightly down because I feel like more of the diseases are neonatal, and I'll go into that in a minute. For certain, there will be a pediatric asthma on the 2020 simulation. The other possibility is pretty similar to what it had always been. It should be some kind of infection, bronchiolitis. It could be a BPD or a congenital defect of some sort. Neonatal is 2, just like it was in 2015. However, ARDS is for certain. So we have infant RDS, and the other one will be a neonatal resuscitation. So the baby's born, fix them. In medical or surgical, this is where we've gone up. And they were nice enough to give us a couple specific ones. So 3 of them are a given. ARDS, just 1 though. 1 infectious disease, pneumonia, something like that. 1 CF or bronchiectasis. And then 2 are kind of wild card. They could be an immunocompromised, berry, psych, or a shock patient. Chronic airway disease is what I was talking about at the beginning, is an entire matrix focused, and it is 7. Outpatient asthma is definitely on there, and there are a couple of those, and that's in addition to the pediatric asthma. And then that diagnosis wild card, and this is where it could be an additional asthma, it could be additional COPD, or it could be CF. So there's and that's all under the diagnosis. So they're going to give you the student the symptoms of the patient, and they need to figure out what it is. All right, so that is it. There's some huge changes on the CSE. If anyone would like the longer version of this, where it goes over everything in a little more detail, just shoot me an email. That's it for this video. Thanks for listening.